Some ideas today that conservative elements of American society are targeting as a sort of liberal ideology actually began as something that conservatives actually supported in an earlier decade and was actually a conservative approach to reforming American healthcare. Between 1965 and 1970, for instance, we see healthcare costs rise dramatically. So everyone, whether you were on the right or the left, saw a problem. And in the 1970s, there was a level of consensus of something had to be done to control costs and try to get more people covered. In the 1970s, we see a significant effort under President Nixon's administration to actually enact a comprehensive reform of healthcare. And that would have been a universal system. It would have been a federally based system, which he supported, and some historians have argued that had Watergate not happened, would have actually had a good chance of it passing. I think the Affordable Care Act should rank up there with one of the more significant changes to American healthcare in the past, century or so. No other country in the developed world has anything comparable to our system where there's no baseline for everyone living in that country. You can actually take out different sort of portions of American healthcare and find that they compare quite well in terms of how they're set up to other systems in other countries that are the national system. So you can look at the Veterans Administration and see that it's set up like one country. You can look at Medicare and see the way that it's set up is very comparable to another nation's sort of system. And then, of course, the employer-based system, which provides healthcare to a large number of Americans. All of these things are operated differently, and they all have kind of divided up the American populace. Historically, we can see why, with each of those systems sort of developing at different time periods with different influences, whereas in other countries they had established a more sweeping reform earlier on. Some historians have argued that because of those pockets, because of that compartmentalization of American healthcare, it's made it exponentially more difficult to change, because you have these different segments of the population that are perhaps more or less happy with the baseline level of care. I would describe our system today as a patchwork. It's a historical patchwork from many different sort of chapters creating healthcare systems for different segments of Americans. And this is very unique.